Hi, this is Dr. Farley. I want to go over with you today the importance of sleep and understanding that sleep is really an essential ingredient for our brains to work properly. We also know that sleep is one of the top 5 or 6 complaints that people that are going to get future neurodegeneration complain of. So that's Parkinson's patients, Alzheimer's patients, MSA patients. A lot of neurodegeneration, one of the first things we're seeing is improper sleep. But what you also want to know is one of the reasons why sleep is so important. It's not just about the system regenerating. Your lymphatic pathways, which is the drainage of the brain down to the neck into the deep lymphatics, is totally dependent upon sleep. And when you're awake, your drainage decreases by 95%. So that means that we don't clear out old stuff from the brain. A lot of proteins that build up over time in the Alzheimer's patients, Parkinson's patients, and these other neurodegenerative diseases, they basically build up inside the brain. They clog up the brain per se. That if you don't sleep properly, the brain will never empty this stuff out. And if the brain doesn't empty this stuff out, then gradually after a while, we don't have proper brain function. And that can be one of the reasons for neurodegenerative diseases and neuropsychiatric issues. The other thing that you want to know, again, I'm linking these together on a more regular basis, that neurodegeneration, there's 2 types. There's transneuronal degeneration, which means the neurons are not fully dead. And then there's permanent neurodegeneration. And how do you know the difference? You measure, you treat someone, and you measure again. If those tests get better, it was transneuronal degeneration. If the tests don't get better with time, then it was permanent neurodegeneration. And what you want to know is that some of the earliest signs of neurodegeneration, again, we just talked about sleep, but we also want to go back and let you know that anxiety, depression, mood imbalances, even bipolar symptoms can be early signs of future neurodegeneration. I had an article that I just recently printed out that bipolar patients have a 700% increased risk of developing Parkinson's disease. So instead of talking about the potential psychological problems that people are having, I think we need to start pulling back again and almost looking at these differently completely, not talking about theories on why they may be having odd symptoms going on, but start looking at this as how does the brain work and why might not this person's brain be working properly, and is this a sign of future neurodegeneration? And I can tell you the answer is absolutely yes. There's tons and tons of research out there, so we have to stop categorizing people with psychological problems and start looking at what's not working well, and sleep is a big one, and we also want to look at the ability of the brain to drain properly through the lymphatic system. And again, sleep is essential for all people concerned with having a good brain, spinal cord, and nerves. So thank you. If you have any questions, please let the office know. Have a great day.